Chair Beyer and members of the committee, thank you for the opportunity to testify in support of House Bill 2092 and the -2 amendment. For the record, my name is Theresa Russell, and I'm a nurse practitioner in Enterprise, Oregon. I live in Joseph. My clinic is in Enterprise. House Bill 2092 and the -2 amendment would extend the time that nurse practitioners can treat a patient for workers' compensation from 90 days to 180 days. I wasn't aware of the entire history, and so that was all. I've always wondered why 90 days. I've been practicing for 13 years, and I can give you a lot of stories. I have my own clinic, Olive Branch Family Health Incorporated. It's new. We've been open 6 months. I have electronic health records, and they tell me that I have about 700 patients in my practice now. So you can see nurse practitioners in rural communities do serve the community and are needed. I'm in a solo practice. I have an independent pharmacy housed under the same roof, and it is run by Bob and Sue Coulter out of La Grande. I like to point out that nurse practitioners in Oregon can practice independently and provide comprehensive care. Our scope of practice includes illness and disease, also injuries, prescribing, dispensing medications, and we practice without the supervision of a physician. In my experience, pretty obvious when a patient comes in with a work comp whether I'm going to be able to manage that patient or if I have to refer them. If I have to refer them, it's usually done right away, and it's usually not to an NP in my community. It's usually to a specialist outside the community somewhere. So a few things that could maybe complicate that care. The instance I put here was one that will always haunt me. It was a lady who came in with a back injury. She was I stabilized her, treated her, and she just didn't get better. She ended up being referred for surgery. The surgeon thought he could take care of it. She was just one of those people. It didn't come together very well. So we ended up with chronic pain management, which I could do, was doing very well. 90 days came in, and I got a letter from SAFE Corporation saying that they would no longer pay me to take care of her. So I referred her to one of the physicians in my practice, and he was like, "Why? You're doing a great job." He didn't know her. He resented it. I resented it. The patient resented it. And it just didn't fit our case. Everything was fine. It was status quo. That's where we kind of got caught in this law. We have, for 7,200 people, 8 providers. We're pretty lucky, but if any of you know where Wallowa County is, it's like a high mountain village. It's very spread out. There's a series of small towns. Once you leave I-84 interstate at La Grande, 20 miles to Elgin, they have 2 clinics there, and they have struggled to keep a clinic there. One is run by a nurse practitioner, one by a PA. 60 more miles down the road, you get to Enterprise, and it's the only place you can get health care in Wallowa County. We have very remote areas in Naha, lots of ranchers, lots of construction people, Forest Service. I actually worked at a clinic in Halfway, which makes Enterprise look like Salem in comparison. You never know what's going to come in your door and what you've got to be prepared to either stabilize, take care of, or ship to Baker City, which is a very rough drive. So it's not easy, and my patients will tell you they're very happy with the care. They come to me because they trust me, they know me, and they expect a certain quality of service from me. So limiting the time that a nurse practitioner can treat a workers' comp patient, in addition to interrupting that continuity of care, can pose a significant challenge for the patient who has to see a physician out of the county or somewhere else. The travel, it's very difficult. So I have a lot I can say. I want to thank you for letting me testify, and I urge you to support House Bill 2092 with the -2 amendment.